I start the video by verifying that the urine specimen is on medical record, and then before the patient comes in, I perform personal hand hygiene, and then the patient enters the room, and I'll identify the patient. So what is your name and date of birth?
My name is Grant Baster. My date of birth is 7/13/2002.
Okay, and I make note of that, and then I begin to explain the procedure to the patient, and I have him perform hand hygiene as well. And before we begin, I check the specimen to make sure that it is the patient's label, which it is. And so before the procedure begins, I'll instruct the patient to take a towelette to clean the tip of the penis, or we'll be cleaning it in a circular motion away from the urethra. And then when you're ready to begin, you'll remove the lid from the specimen container, and you'll start by voiding a small bit of urine before you pee into the cup. And then after you've let a little bit go, then you'll continue to fill up the cup and then discard of any urine after that. And then make sure when you're peeing that you don't let the cup touch any of your skin. And then once you're done, you could put the lid back on and return it to me. Okay, so after I collect the urine sample from Grant, before I begin, I perform personal hand hygiene, and I put on my PPE, my gloves, and then I make sure to check the reagent strips for the expiration date and make sure that they are still valid and ready to use. And I also make sure that I'm checking the specimen to make sure that this is Grant's urine. And after I confirm all of those things, I will take a reagent strip out, and open up the container. And I'll use the reagent strip and dip it fully in so that all of the squares are submerged. And then I'm going to briefly tap it sideways. And then I am going to compare this to the chart online and mark all the findings. I also make sure to note the color and the appearance of the pee, and it appears to be yellow and clear. And after I've concluded this, I'll make sure that I close the urine collection, and I will discard of the reagent strip into the wastebasket. And then I will continue to take off my PPE and make sure I dispose of those as well.